Zinc is an important mineral that your body requires for several body functions. Zinc is important for the immune system, wound healing, and normal growth and development during pregnancy, childhood, and adolescence. Adding enough zinc to the diet also helps reduce the risk of age-related diseases. An adult man needs 11 milligrams a day, and an adult woman 8 milligrams. Zinc also enhances the action of insulin. In this video, we are going to discuss 11 warning signs your body needs more zinc. The video is going to be amazing, so make sure you stick to the end. Before starting the video, be sure to smash the like button and subscribe to never miss out on any of our videos. 11. Wounds that won't heal. Zinc helps maintain the integrity of skin and mucosal membranes. Patients with chronic leg ulcers have abnormal zinc metabolism and low serum zinc levels, and clinicians frequently treat skin ulcers with zinc supplements. While zinc has been hypothesized to promote wound healing, the research to support daily doses of elemental zinc without a confirmed deficiency is lacking. Plasma and serum zinc are the commonly used laboratory tests to assess zinc status. Due to the wide distribution of zinc throughout the body, as a component of protein and nucleic acid, these tests don't reflect zinc status. Hence, zinc deficiency is difficult to diagnose. Some wound care protocols recommend a daily zinc supplement with elemental zinc, such as zinc sulfate or zinc gluconate, to accelerate wound healing. If zinc supplements are considered, the order should include a time limit for administration and tolerance should be monitored. 10. Diarrhea. Acute diarrhea is associated with high rates of mortality among children in developing countries. Zinc deficiency causes alterations in the immune response that probably contribute to increased susceptibility to infections, such as those that cause diarrhea, especially in children. Studies show that poor, malnourished children in India, Africa, South America, and Southeast Asia experience shorter courses of infectious diarrhea after taking zinc supplements. The children in these studies received 4 to 40 milligrams of zinc a day in the form of zinc acetate, zinc gluconate, or zinc sulfate. In addition, results from a pooled analysis of randomized controlled trials of zinc supplementation in developing countries suggest that zinc helps reduce the duration and severity of diarrhea in zinc-deficient or otherwise malnourished children. 9. Loss of appetite. This decrease in appetite is the first visible sign of zinc deficiency, and it occurs well in advance of any other symptoms associated with zinc deficiency. Zinc concentrations are in plasma and tissues. A zinc-sufficient diet containing zinc chloride acutely stimulated food intake after short-term zinc deprivation. In sham-operated rats, the oral administration of zinc-stimulated food intake, whereas zinc and saline administrations did not exhibit differing effects in vasectomized rats. Zinc stimulates food intake in short-term zinc-deficient rats through the afferent vagus nerve, with subsequent effects on hypothalamic peptides associated with food intake regulation. 8. Your bones are weak. Everyone talks about calcium for bones, but zinc is an essential mineral required for bone growth and formation, says Dr. Jenkins, thanks to its function in cellular growth and development as well as the collagen turnover needed to make healthy bone. Children of vegetarians or vegans on very strict diets can often become deficient in this mineral, which can be a problem in the development of their bone through childhood and teenage years. A meta-analysis showed zinc supports your immune system enough that supplementing with it can reduce the duration and severity of the common cold, as long as it's taken early. Preliminary work seems to show that lozenges made of zinc gluconate are as effective as zinc acetate. 7. Open sores on the skin. Zinc deficiency results in skin changes that can look like atopic dermatitis in the early stages. The difference is that zinc deficiency does not improve when treated appropriately with topical steroids and moisturizers. The skin takes on a cracked, glazed, and fissured, crazy paving appearance around the mouth, the nappy area, and the hands. The person may experience hair loss, nail changes, and an increased chance of getting diarrhea as well as skin and other infections. The affected person may be irritable and experience a general failure to thrive. Nonetheless, recognition of cutaneous lesions related to zinc deficiency is important for several reasons. First of all, they are the most visible among all manifestations and are specific enough to allow diagnosis with reasonable certainty. Secondly, the condition responds well to zinc supplementation. All the manifestations, if treated in time, resolve without sequelae. 6. Hair loss. Hair loss or alopecia is an extremely common sign of zinc deficiency. Although not everyone with low zinc will develop it, luckily it seems like hair loss from this can be reserved or alleviated by bringing up zinc levels in the blood. In one small study, hair loss slowed or was cured by zinc supplementation in people who were deficient and suffering from alopecia. In another study, 9 out of 15 patients saw an improvement, although researchers say this isn't significant enough to make conclusions because of the small study size. More work needs to be done, but dietary zinc can be an easy and safe way to bring up low numbers and potentially slow or stop hair loss. 5. Changes in their nails. Zinc is an essential nutrient that can contribute to the health of a person's hair, skin, and nails. Zinc deficiency, which may be due to a lack of zinc in the diet or an underlying medical condition, can cause nail dystrophy. Zinc is a micronutrient that plays an important role in human metabolism. Within the body, it catalyzes enzymes, enables protein folding, and regulates gene expression. Without each of these processes, a person's body would not function properly. Zinc enables protein in the body to grow and remain strong. This includes protein in the nails. A 2013 article suggests that without enough zinc, the rate of nail growth decreases, and the nails themselves become fragile and brittle, causing them to crack. If zinc quantities in the body are particularly low, a person may lose their nails completely. Brittle nails are thin and break very easily. They may split horizontally, forming layers. The cuticle is dead skin that a person can see at the base of the nail. Zinc deficiency can cause the cuticle to become inflamed. 4. Teeth aren't exactly sparkling. Zinc is essential to healthy teeth, and if you have low zinc levels, you aren't going to have nice shiny white teeth. They may instead be easily cracked and not very strong, says Dr. Jenkins. To find out why, Healthista spoke to James Gulnick, a dentist at Bone Lane Dental Group, London. Zinc is an essential element in the mouth and is present naturally in plaque, saliva, and enamel, says Gulnick. If someone was deficient, they might notice an odor sensitivity, altered taste, white tongue coating, and perhaps be more likely to develop mouth ulcers plus inflamed gums. These are most common if people are deficient in zinc from their diets. 3. Eye problems. Zinc is found in the eye in very high concentrations, especially in the retina. This is why a zinc deficiency can be related to the cause of macular degeneration, when a mineral doesn't have a direct action on the eyes, but a deficiency of it can lead to various vision disorders. Many people try to determine the connection. A zinc deficiency can result in problems with adaptation to darkness, which is often called night blindness. Zinc is important for every part of the eye, but night blindness is more often related to a vitamin A deficiency. Zinc actually is required for the transport of vitamin A in the blood, but that's not all it does for vision. Zinc is important for the conversion of vitamin A to the retinal and the conversion in the liver to the rhodopsin. This is why alcoholics can easily become zinc deficient in a short period of time. 2. Impaired immune system. Impaired immune function in people with zinc deficiency can lead to the development of respiratory, gastrointestinal, or other infections. Examples: pneumonia. The levels of inflammatory cytokines in blood plasma are affected by zinc deficiency, and zinc supplementation produces a dose-dependent response in the level of these cytokines. During inflammation, there is an increased cellular demand for zinc, and impaired zinc homeostasis from zinc deficiency is associated with chronic inflammation. Red meat such as beef, pork, and lamb are among the best sources because the zinc in these foods is highly bioavailable. That means our bodies can more easily absorb it compared to other sources, says Carrie Ruxton. 1. Common cold. Zinc has been investigated extensively in developed countries for its ability to treat the common cold, or upper respiratory infections (URI). This is an intervention that has had modest uptake in pediatric practice in developed countries, but it provides an example of a pharmacologic effect since most individuals would be presumed to have sufficient zinc status at baseline. The theoretical basis for zinc's effectiveness against viral-induced URIs, upper respiratory tract infections, includes inhibition of viral replication or of intracellular adhesion or an enhanced innate immune response at the mucosal surface. Zinc lozenges and intranasal sprays have both been evaluated to shorten the length of the URI, upper respiratory tract infections, symptoms. Let us know your opinion in the comment section below. This was all for today. Hope you liked the video. Do not forget to subscribe to our YouTube channel. Stay safe, and we will be back soon with another video. Please click on the next video clip to watch for more health info. Thank you very much.